Greetings, health enthusiasts around the globe. Today, we explore a topic that is often overlooked but could be affecting your health: sleep apnea. This sleep disorder, characterized by repeated interruptions in breathing during sleep, is more common than you might think, with various risk factors such as overweight, age, and smoking. It's not just about snoring loudly or feeling tired after a full night's sleep. So buckle up as we delve into the dangers of sleep apnea and the treatments available. So, what exactly is sleep apnea, you may ask? Sleep apnea is a prevalent sleep disorder characterized by repeated interruptions in breathing during sleep. These pauses, known as apneas, can last from a few seconds to minutes and may occur 30 or more times in an hour. The most common type of sleep apnea is obstructive sleep apnea. This occurs when the muscles in the back of your throat relax, blocking the airway and causing you to snore loudly. When this happens, your brain wakes you up to reopen the airway, a process so brief you don't even remember it. But imagine this happening over and over again throughout the night. It's no surprise that you wake up feeling exhausted. So, how do we diagnose sleep apnea? Typically, it's identified through its symptoms: loud snoring, daytime fatigue, and observed episodes of stopped breathing during sleep are some of the common signs. However, not everyone who snores has sleep apnea. To confirm the diagnosis, doctors usually rely on sleep studies which monitor your heart, lung, and brain activity, breathing patterns, arm and leg movements, and blood oxygen levels while you sleep. Now that we understand what sleep apnea is, let's explore its different types and levels of severity. Opening. Not all sleep apnea is created equal. Indeed, sleep apnea, like many other health conditions, varies in its types and severity. Broadly speaking, there are three main types of sleep apnea: obstructive, central, and complex. Obstructive sleep apnea, or OSA, is the most common type. It occurs when the muscles in the back of your throat relax too much during sleep, causing the airway to collapse and disrupt your breathing. Snoring is often a telltale sign of OSA. Next, we have central sleep apnea, or CSA. Unlike OSA, the issue here is not a physical blockage, but a communication problem. In CSA, the brain fails to send proper signals to the muscles that control breathing. As a result, you may experience periods of shallow breathing or even stop breathing altogether for brief periods during sleep. The third type, complex sleep apnea, is a combination of both OSA and CSA. This means that even if the physical blockage is removed, the individual might still have problems with breathing because of the faulty signals from the brain. The severity of sleep apnea also varies from person to person. It is usually categorized as mild, moderate, or severe. In mild cases, individuals experience 5 to 14 episodes of interrupted breathing in an hour. Moderate cases have 15 to 30 interruptions per hour, while severe cases can have over 30 interruptions in an hour. The severity of sleep apnea doesn't just affect the quality of your sleep. It can also have serious implications for your overall health. For example, severe sleep apnea can increase the risk of high blood pressure, heart disease, stroke, and diabetes. However, it's important to remember that any level of sleep apnea should not be ignored. Even mild sleep apnea can lead to excessive daytime sleepiness, reduced cognitive function, and a decreased quality of life. Closing. Understanding the type and severity of sleep apnea can help us comprehend its potential dangers. It's a critical first step in managing the condition effectively and reducing its impact on our health and daily life. Sleep apnea is not merely a minor annoyance or inconvenience. It's a serious condition that, if left untreated, can lead to a range of health risks and complications. One of the most significant dangers associated with sleep apnea is the increased risk of heart and vascular diseases. When you stop breathing during sleep, your body experiences a drop in oxygen levels. This can lead to an increase in blood pressure and strain your cardiovascular system, increasing the likelihood of heart disease, heart attack, stroke, and irregular heartbeats. But the risks don't stop there. Sleep apnea is also linked with diabetes. When your sleep is disrupted, your body's insulin resistance may increase, making it harder for your body to control blood sugar levels. This can lead to type 2 diabetes. The connection between sleep apnea and obesity is a bit of a vicious cycle. Excess weight can contribute to sleep apnea, and sleep apnea in turn can promote weight gain. This is because sleep deprivation affects the hormones that control appetite, leading to overeating and eventual weight gain. Beyond these physical health risks, sleep apnea can also have a significant impact on mental health and daily life. It can lead to daytime sleepiness, fatigue, and a lack of energy, which can cause accidents, especially while driving or operating heavy machinery. It can also lead to attention disorders, affecting your ability to concentrate and perform tasks efficiently. Moreover, sleep apnea can adversely affect your mood, leading to irritability, depression, and anxiety. It can also affect your relationships, as the loud snoring associated with sleep apnea can disrupt the sleep of those around you. The consequences of sleep apnea extend beyond the night and can seep into every aspect of your life. It's not just about getting a good night's sleep. It's about protecting your overall health and well-being. With these potential dangers, it's clear why treatment is essential. Fortunately, sleep apnea is a treatable condition. This statement is a beacon of hope for those struggling with this sleep disorder. Let's explore the various treatment methods available. Continuous positive airway pressure, or CPAP therapy, is the most common treatment for moderate to severe sleep apnea. This involves wearing a mask over the nose and/or mouth during sleep. The mask is connected to a machine that delivers a steady stream of air to keep your airways open and ensure uninterrupted breathing. Admittedly, adjusting to the CPAP device can be a challenge, but its benefits are worth the effort. Another option is wearing other breathing support devices. These include bi-level positive airway pressure devices, or BiPAPs, and adaptive servo ventilation, or ASV devices. BiPAPs are similar to CPAPs, but use different air pressure settings when you breathe in and out. ASV devices, on the other hand, store information about your normal breathing pattern and automatically use airflow to prevent pauses in your breathing while you sleep. Oral appliances designed to keep your throat open can also be used. These include mandibular advancement devices and tongue-retaining mouthpieces. They work by shifting and stabilizing the lower jaw, or by holding the tongue in a forward position to keep the airway open. Surgical interventions are another possibility if other treatments aren't effective or aren't desired. These can range from tissue removal and jaw repositioning to implants and nerve stimulation. In addition to these treatments, lifestyle changes can be highly effective in managing sleep apnea. Regular physical activity, a healthy diet, and avoiding alcohol and smoking can help reduce symptoms. Weight loss is particularly beneficial, as even a small amount of weight loss can help open up your throat and improve sleep apnea symptoms. Remember, seeking professional help is crucial if you suspect you have sleep apnea. Your healthcare provider can guide you to the treatment that's best for you, helping you to sleep better, feel better, and live better. So don't let sleep apnea rob you of restful nights and energetic days. Act today. Sleep apnea may be a silent intruder in many people's lives, but it doesn't have to be a permanent one. This is the key takeaway from our discussion today. We're all vulnerable to the occasional disruption in our sleep, but when it becomes a pattern, it might signal a more serious condition, sleep apnea. Throughout this video, we've unearthed the truth about sleep apnea, what it is, its symptoms, the different types, and its severity. We've highlighted that it's not just about snoring or feeling tired. It's a serious sleep disorder that can lead to severe health problems if left unchecked. We've learned that sleep apnea can increase the risk of heart and vascular diseases, diabetes, obesity, and even accidents due to impaired alertness. These risks reinforce the importance of understanding and recognizing sleep apnea. If you or your loved ones are experiencing symptoms like loud snoring, episodes of stopped breathing during sleep, or excessive daytime sleepiness, it's crucial to seek medical advice. We've also explored the different treatment options available for sleep apnea, from continuous positive airway pressure, CPAP therapy, and other breathing devices to oral appliances and surgery. There are a variety of solutions that can help manage this condition. Lifestyle changes such as weight loss, quitting smoking, and limiting alcohol can also play a significant role in treating sleep apnea. Remember, it's not just about treating the symptoms. It's about addressing the root cause to improve your overall health and quality of life. The first step towards this is awareness. The more we know about sleep apnea, the better equipped we are to recognize and address it. So let's not allow sleep apnea to steal our peaceful nights and productive days. Let's take charge of our health, seek help when needed, and encourage others to do the same. Stay vigilant, stay healthy, and remember, good sleep is a key component of overall wellness. Until next time.